young man between the age of 40 and 45 is diagnosed with prostate cancer, will he be still be able to get an erection? And if
can you get a woody?
If he has prostate cancer and is being treated, how long will he be able to maintain that erection?
Okay, go ahead.
So, you want to answer that or you want to
I can answer. So it just depends on your erectile function to begin with.
Yeah. So there are a bunch of things that one has to put into consideration.
Yeah.
Some people come in and they already, as we age, the performance goes down. And there's some things that affect your sexual function. If you're diabetic, if you have an infection, at the same time, high blood pressure. So all those things come into play. Now, when we treat, the reason why people get sexual dysfunction, at least with the treatment, surgery or radiation, is that there are nerves, there are neurovascular bundles, just at the posterior aspect of the prostate that kind of hug the prostate. Now, either you maintain sexual function as you would always like to, or you have the disease to grow. And so our job is to take care of destroying the cancer cells first and then worry about the sexual dysfunction later. Okay? So, but I've seen patients who say, I'd rather not do anything because I'm not going to go. And I've had that. Somebody says, I won't take any anti-hormones because it's just going to destroy my life. And what's life without that? So, and that's totally okay. But our main objective as physicians is to take away the biggest risk to your life. And then if we can manage the dysfunction, then that's fine. But there's no way anyone can tell you that I'm going to give you this treatment and you're going to walk out 100% the way you came back.
I think Dr. Nebnani mentioned statistics that with regards to surgery, the risk of impotence after is less than 10%?
Okay, so it depends on what treatment you're having. So it depends if you're going to have brachytherapy, which is radiation seeds in the prostate, external radiation, or surgery. No. To your question, you said if you're 45, no. Like Doc said here, some patients will say, okay, they don't want to have nothing done at all. No, a 40 or 45-year-old male diagnosed with prostate cancer, it will spread more than likely during their lifetime. And if that is not treated, spread of prostate cancer can lead to spread to the bone and paralysis, where erection will be the least of their problems. So that patient not doing anything. Now, erectile dysfunction and incontinence is a reality of treatments of prostate cancer. The degree, depending on the treatment, depending on your erectile function before, all these come into play. So to answer your question, you would say, what would be the chances of you maintaining erection? So like Doc said, if you don't do nothing, you'll probably have your erection for a bit of time, but the cancer will progress. If you have treatment, there is a risk of erectile dysfunction with radiation and with surgery, even though we do a nerve sparing procedure. Now, some people quote, like if you go online and see some fancy robotic centers in the States, they say a 10%. But it's not that you're going to have the same exact erections like you did when you're 30 years old. It may decrease a little bit. You may be able to have satisfactory intercourse with use of medication, right? So your erections are definitely not going to get better. They may get worse. And there is also there's a small possibility you may not have any erections at all. So, it's really dependent on the person, depending on what procedure is done.
So let me ask the question. It affects erections, but what about ejaculation?
Okay, so
when we treat with radiation, again, we go back to managing risk. So we have to say, are we going to treat the prostate alone? Are we going to treat the prostate and seminal vesicles because the disease can invade the seminal vesicles? Are we going to treat the prostate, seminal vesicles, and the lymph nodes? And so once that decision is made, whatever happens after that depends on the extent of treatment. So if you treat both the seminal vesicles and the prostate, chances are it's going to affect the ejaculate, okay? And let me just say something, is that I think this is one of the more important things for the men, because that's what I notice when they come in with their wives. It's just a very important thing, and we don't want to talk about it, but I think we should be open to ask questions like this.
Yeah, and I actually just saw a couple before I flew down to Barbados, and I find that this is more common among black men than Caucasian, and I mean, I don't like to stereotype for obvious reasons, but I find that in those discussions, they're quite bashful, and the reason is that there is an MS. You know, the syndrome is MS, and I don't mean multiple sclerosis, I mean macho syndrome. And so, in the sense, and so when the wife is present with the patient at follow-up, the discussion is not entered, and when I ask pointed questions, no one wants to expound on that. And so I usually preface that question by stating that when you're treated for prostate cancer and your PSA has decreased precipitously, and we're all celebrating the fact that you're doing so well, then the next step is actually to ensure that you have quality of life.